Each day of our lives, we have freedom to make many decisions which molds who we are, such as religious freedoms, civil freedoms, freedoms to make choices in how we live our lives and how we take care of ourselves. All individuals have this right during our lifetime, and I feel that we should have the right to make decisions regarding the end of our life. Persons who are suffering from terminal illnesses should be able to minimize the pain and suffering and have some control over the time and the environment in which they choose to die. There are some laws and legal vehicles that currently allow us to have control over medical decisions when we are incapacitated or become at that point incapacitated. These forms are, as we often hear of, are living wills, and some of them are advanced directives towards medical care. A very common directive is the DNR, which is a do not resuscitate directive. And according to U.S. News, in an article published by Michael Kirkland, the DNR is fairly well established and very hard to attack in court. In the U.S., the physician-assisted suicide for terminal patients is legal in the states of Oregon, Montana, and Washington State. Euthanasia is not legal anywhere in the United States at this point. Physician-assisted suicide is defined in Wikipedia as prescribing or providing drugs to a person by a physician, and so that person can end their own life and suffering if they are terminally ill. Euthanasia is a little bit different in the fact that the physician gives the direct administration of drugs to the patient with the intent to end that patient's life upon their request. And according actually to the 2002 Gallup poll, 72% of Americans support euthanasia as a choice as to way for someone to end their life. I believe that the law should allow persons to choose euthanasia or a physician-assisted suicide. The lack of a legal freedom to be able to choose that can cause, to me, undue suffering and for patients of terminal illnesses. The Netherlands currently is the only country that allows euthanasia. As against that one stated before, that the physician's assisted suicide is allowed in the states of Oregon, Washington State, and Montana. And according to the U.S. News report, the Oregon ballot was established in 1994, and it was labeled Ballot 16, and it's related to the Death with Dignity Act, which gave terminally ill individuals the right to physician's-assisted suicide. Washington State followed suit very closely with very similar guidelines that are in place. Montana actually had a Supreme Court decision in 2008 and found a physician is not liable under state law for giving a terminal patient a drug that he or she can use to end their own life. So it is there's no recourse in the state of Montana for physicians who are assisting terminally ill patients commit suicide. The guidelines for physician-assisted suicide is very specific in that the individual must be considered to be of sound mind. They have to have two physicians' opinions, both indicating that the patient is terminal and has an estimated time of 6 months to live. There must also be two persons who witness this request, one non-medical and one non-related individual has to witness this. And then the person requesting the physician-assisted suicide has to make the request again within 15 days of the initial request. A physician is obligated to provide patient and physician relationships, which include, incorporating obviously the patient's wishes and what they want to do at the end of their life. And according to Dr. B.R. Sharma in the Journal of Clinical Forensic Medicine, a patient may feel abandoned in their most dependent and stressful time of their lives due to physicians' inability to assist them in fulfilling their final wishes. Unfortunately, individuals will often seek other options to end their lives, such as paying someone to actually murder them, or trying to have to leave out of state and find other advocacy groups that are not medical professionals to assist them at their end-of-life wishes. It seems like it would just be so much better if a person could choose and be in a very calm, serene setting, a peaceful setting, surrounded by those that they love and care about when they do choose to leave. And according to the Lancet Journal on Oncology, the majority of the individuals that do request physicians-assisted suicide in the legal states here in the United States are those typically suffering from terminal cancer. I believe that we should have a legal right to physicians-assisted suicide or euthanasia if we so choose. The ability to do so would limit suffering and pain. It would allow the individual to express feelings and say goodbyes to loved ones in their own terms and when they choose to go. They would also be allowed to die with dignity and not be suffering. I believe that it's our life and it's our choice as to how we go in the end when we know that we are going to die. I think it was very well stated by Justice John Warner of the Montana Supreme Court. He stated the state has not come close to showing that it has interest, much less compelling interest, in usurping a competent, incurably ill individual autonomous decision to obtain a licensed physician's assistant in dying so that he or she might die with the same human dignity in which he or she was born.